What's up guys, Jordan Kaplan here from Kaplan Chiropractic Center. Welcome back. Today we have Vanessa, our office manager, and today she's in workout gear because we're going to talk about something called runner's knee, which afflicts a lot of people who work out. The times are changing, spring is here, everybody's out running, and a lot of people suffer from runner's knee, which affects about 20% of people. It's not a very serious condition, but it does afflict a lot of people and it can be very painful. So today we're going to talk about what it is, how did it happen, and how are we going to fix it, and we're going to go from there. So runner's knee is something which is called patellofemoral disorder or syndrome, essentially where the kneecap meets the femur, there starts to become a lot of irritation and inflammation, and it happens from overuse and repetitive things like this. A patient will notice pain when they run, they'll notice pain when they run for long periods of time, and they'll notice pain especially if they're sitting with their knee bent for longer periods of time, sitting at work, sitting in a movie theater, things like this. How does this happen? Well, it happens from being unwise in how you train and overtraining, training too much, putting too much mileage on your knee, or it happens from instability in your body. Maybe there's a weakness of something called your VMO, which is the inside of your quad here. We're going to talk today about how to fix that. Or it could happen from weakness from people who sit too much in their glute medius. The glute medius is the muscles that sit on the outside of your leg, the small muscles in the butt, and that's where you get your power from, and weakness in that can also cause runner's knee. So how are we going to fix that? Well, first and foremost, you're going to see your chiropractor, and they're going to assess your pelvis and fix it. You can also do ice massage. That's a way to bring down inflammation. We'll send you a video later on how to do that. You want to have an anti-inflammatory diet, heavy leafy greens, bright vegetables, fish oils, things like that, which we can talk about at a later point in time. Today we're going to talk about three things: kinesiotaping the knee, and then two areas to rehab. So we're going to start. Vanessa's going to show us the VMO, which essentially is the muscle in the middle of her leg. The first thing you want to do is just simply contract it. She's going to extend her left leg all the way out, like she's kicking, all the way towards the ceiling, and then let it relax. When you come up, do it again. You want to turn your toe a little bit to the outside. Good. And then come back down. You should feel a squeeze on the inside of your leg, and you should feel a little ball forming there. That's your VMO. You're going to do that a couple sets of 10 on both sides. The second thing you can do to isolate that is isolate your VMO is do something called a sumo squat. So Vanessa's going to stand up really quickly. You're going to take a wide stance. You're going to point your toes a little bit to the outside. And as you come down, you're going to squat. And when you come back up, you're going to squeeze the inside of your leg. Back down. Good. Okay, so those two movements are going to help us build your VMO. Next, we're going to go into Suzanne Summers mode because we're going to show you how to build your abductors now. So Vanessa's going to lay on her side, left side up. First thing we're going to do is work on the abductors, a really basic movement. The bottom leg is going to be slightly bent, the top leg is going to be straight, and all she's doing is elevating her leg up this way and letting it relax. Coming back up, letting it relax. Make sure there's not too much stress in your knee, but it's going to be building up the glute medius, which is back here. The second thing you can do is called a clamshell. The bottom leg is going to be bent again. Top leg is going to be bent, and all she's doing is simply lifting up her leg this way, like a clam would open its mouth, letting it drop back down, bringing it back up, dropping back down again. All right, you can sit back up. Those two movements over time will help us to strengthen those muscles and give us a better pelvis and a more stable body so you take stress off your knee and you feel better. Please run as you can. If you can run a little bit and it doesn't cause you pain, then continue to do so. If you are having problems, tailor back through these exercises. We're going to teach you in the next video how to kinesiotape your knee. If you have any questions, hit us up on Instagram or Facebook. You can send us a message. We'll see you soon. Have a good day. Thank you.